Okay, so I'm going to be cleaning Anna's skin here. We tend to do this with baby wipes, which are non-alcoholic. We don't use alcohol wipes because they're said to denature the Botox. So I want to wipe. I don't want to wipe my marks off too much. So just clean sort of area up. And obviously Anna's not wearing much makeup, but if she was, we would like her to remove the makeup really before we did the marks. Okay, so I've talked in videos before about how to make up the botulinum toxin, so if you'd like any information about that, please have a look at the other videos. But essentially I've got a ready-made syringe here of botulinum toxin made up with the saline. So now close your eyes, Anna. Okay, now I always do it in the same order, and I generally start in the injection in the procerus first. So here I go, and I'm just going to inject gently, just a little prick, Anna. Okay, that's my first injection to procerus. No, well done, Anna, you're doing really well. Then just 2 injections into corrugator, either side. You're doing really well. I'm sorry it's a bit uncomfortable, you're doing really, really well. Last injection in that area. That's it. Okay, so now I've treated the whole glabellar area, so I've done those 5 injections. Next going to move on to the forehead area. You're right, Anna?
Perfect, thank you.
Good, you're doing really well. So I always do it the same way. I do the hardest one, like in surgery, you do the hardest stitch first and then work towards you. So with Botox, I always do the furthest away and then work towards me. So it's just popping under the skin, little injection under the skin. See, just raising little blebs. I'm looking out for blood vessels, really trying to avoid any blood vessels. And so far, so good. I haven't hit any blood vessels. I'd know if I had, because I get an immediate backflash of blood. Okay, Anna, would you mind just... There we go. So this is the area, you've got to be very, very careful, because this is where, if you're going to get a bruise, this will be the area. So I'm just going to go very superficially here. 3 injections, Anna. Just going to do 1 now. 1, 2, 2, and then 3. That's great, that's 3 injections there. Now while I'm here, I might just do your nasalis ones. Okay? So Anna, if that's okay with you?
Of course.
You sure?
Mm-hmm.
Just 2 more here, okay? Little injections. 1 there. These are a bit more tender normally. 1 another. That's it. Okay? Alright. So well, how are you feeling?
Oh.
You're alright?
Perfect, thank you.
Alright.
Just
okay.
counting down how many to go.
There's just another 5 more ones to go. Alright?
Perfect.
Great, so stop that. Okay, so I'm just going to do the last 3 injections. Anna, are you ready for this?
I'm ready.
Okay, 3 more little injections and then it will be over. Sorry, that was a bit sore, wasn't it? 1, just 2, you're right. And then it's a bit sore, 3. And then I'll just do the nose ones in a second. Okay, that's 1, and then 2. That's it. Well done. How are you feeling?
Very well, thank you very much.
Alright. Okay, so now I've done all the injections, so we're just going to clean the area off. Now, what we tend to do immediately, I'm pretty confident on Anna I haven't made any bruises. You know really if you've made a bruise because you get immediate small amount of blood coming back. So you can see she's got a little sort of marks where the injections went in. And if Anna wanted just to put some blusher on or some makeup on, that would be absolutely fine, just to cover these marks if she was going out. So what I like to do is ask the patients really to use their muscles a bit more for the next hour. So if you could just sort of frown a little bit every sort of 10 minutes, raise your eyebrows and smile. That just helps bind the Botox. We ask you normally to avoid any heavy exercise for 4 hours and ideally any alcohol for 4 hours. Would that be all right?
4 hours.
4 hours. Yeah, so it's not lunchtime yet. So you know, those are things because they tend to increase the blood flow to the face and can alter the Botox effect. Okay, how are you feeling?
I'm feeling younger. Thank you very
Already?
much. Yeah.
All right. Thank you very much.
Thank
Anna.
you.